Hi, everyone. This is Mike with Mike Higdon Storytelling Studio. We are now on the 6th episode of Renown Rounds, and I'm excited that we're getting close to the end of the strategic pillars, but that doesn't mean that's the only things we have to talk about. Today, we're going to go through the pillar that's called Building an Integrated Academic Health System. And so you'll see I have three people here with me today that are going to talk about that. To my left, there's Dr. Paul Hauptman, the Dean of University of Nevada, Reno School of Medicine and Chief Academic Officer at Renown Health. Chris Bossy, the Chief Government Relations at Renown Health, and Dr. Bill Plouth, Chief Medical Officer at Renown, and Associate Dean of Clinical Affairs at UNR Med. So there was a lot, so that's all we have. No, I'm kidding. We're going to have you guys kind of explain a little bit more about yourselves, your background, and what you do, and I'll start with Dr. Hauptman.
Well, thanks for having us. Yes, I'm Dean at the University of Nevada, Reno School of Medicine and Chief Academic Officer at Renown Health, and that's a hybrid position. UNR Med is a research-intensive, community-based medical school. We have 280 medical students and approximately 48 PA study students, 30 graduate students, up to about 25 students receiving their master's degree in speech pathology, and about 120 undergraduates in speech pathology and or audiology. We have this very important affiliation with Renown Health that's growing clinical trials, research, graduate medical education, and I think it's been a big step forward for the Reno community and for Nevada as a whole.
Awesome. Thank you.
Good afternoon. I'm Chris Bossy, Chief Government Relations Officer with Renown Health. I've been with the organization for over 30 years. I started in the financial area and actually was the Vice President of Finance for Renown Regional Medical Center, South Meadows, and the Rehab Hospital up to about 2005. I transitioned to government relations at that time, and I've been lucky enough to work with our leadership team, both at UNR Med and at Renown Health, as we enter this journey of becoming an academic medical center. And basically the work that I get to do is working with those teams to make sure that people understand the value that this relationship brings to our community and how we are able through this relationship to better serve our patients.
Awesome. Thank you.
And as you introduced me, I'm Dr. Bill Plouth, Chief Medical Officer with Renown and Associate Dean of Clinical Affairs with UNR Med. Had the pleasure of being part of the Renown and UNR team for close to 3 years now. And as my background, did my training in San Francisco, where I met my wife. We got married up in Tahoe, and it took us 25 years to come back. But bar none, the best place we've ever lived, and just very proud to be a part of the team. As Dr. Hauptman alluded to, we're in the fourth year of our 50-year affiliation, and with that, we have a lot of combined positions just to make sure that we've got representation on both sides, with the president of the university also being a member of the board of Renown, and I hold two positions like Dr. Hauptman does. And as Chief Medical Officer, am responsible along with my Chief Nursing Executive to ensure quality and safety of the care that we provide at the hospital. And with my UNR title and responsibilities, oversee the clinical environment to make sure that we optimize the learning environment, make it positive and conducive to train the future medical and nursing leaders of the future.
Awesome. Thank you, guys. Who wants to take a crack at it, or maybe all three of you, are explaining what an integrated academic health system is?
Well, maybe I'll take the first stab at it. I think what's important is to distinguish an academic health system from a teaching hospital.
Okay.
If you have medical students in your hospital, or you have a residency program, which occurs after graduation from medical school, you're a teaching hospital. If you have that plus clinical research and a real focus on academics, then you have the next next elevated tier of health system, hospital, and healthcare delivery. I mean, we're on the cutting edge of a lot of things because we are an academic health system. Whether it's transplant or advanced life support, these are the sort of things that one expects in an academic health system. The latest medications, the latest technology can be delivered, and the physicians who generally work in an academic health system are also individuals who are on the cutting edge. So it creates it's a different kind of environment, one that I'm used to, that I grew up in, and have spent my entire professional career in.
Awesome. Excellent.
The only pieces I would add you did a great job. The only pieces I would add are the components that I think resonate to kind of people outside our organization, which are the speed and the breadth in which we've been able to expand access to care. I think electeds, state leaders, federal leaders, community members, all very much are appreciating the benefit of this academic affiliation because we have been able to deliver on expanding access to care significantly. The piece that's probably less obvious, because only when you need it are the clinical trial pieces. So we've been able to more than double our clinical trials. Prior to the affiliation, we were only in 3 specialties, for example, and now we're in 10 specialties, and we've more than doubled the clinical trials that you can access. And those tend to be the pieces that the community and leaders get light up about when they hear the amazing things that we're doing. And of course, the last component, and some would say the most significant component, is us growing our teaching programs, because we have grown significantly since the affiliation.
Gotcha.
And I think the access to clinical trials is incredibly important and really been led under Dr. Hopman's leadership and the clinical research team. As Chris was just sharing, we're involved in these clinical trials, which then allow patients to get medications and therapies close to home that otherwise would not have been available to them. And we're just increasing that opportunity every day. Also in the fact of that we are the safety net hospital and provide the highest technological care of patients for about 100,000 square miles. It's a wonderful learning environment and also very attractive for those clinical trials as well.
Gotcha.
And above and beyond clinical trials, there's also the concept of what we refer to as translational research. So we have a real national reputation at the medical school for research in muscular dystrophies, in infectious disease diagnostics, in what's called smooth muscle biology. And these areas are clinically relevant. We like to believe that we can take some of the findings of that research and bring them to the patient at the bedside, learn from that, and then go back to the lab and reassess. So it's called bench to bedside and back again. And that's the sort of thing that one expects out of an integrated academic health system.
Gotcha. Have you, Dr. Plouth, experienced that in other places you've been, the difference between the teaching and the system you guys are working in now? And it sounds like it's part of your job to try to coordinate what's going on at the school and learning and apply that to people in the field, I guess?
Certainly growing up, I grew up in a family of doctors that were all academic, and certainly all my training was at academic centers, but my professional career, for a variety of reasons, was more focused on independent hospital care. And so it's been a delight to come back to the academic center. And with that, it's very natural to me interacting with our physician leaders and helping build on the tremendous reputation that they've built clinically and expanding that into the academic realm. And one of the things I was going to comment about the integrated academic health system is that we're also able to attract top talent and people that otherwise might not be interested in either a pure academic center that's been maybe more established over time, and maybe less nimble or progressive as we are, or ones who have only been interested purely on the clinical side and less on the academic. But we offer the best of both worlds and have attracted top talent, because one of the other goals that we have and that we're actively working together on is expanding our teaching opportunities, and both opportunities for our medical students, but also graduate medical education, and expanding our residencies and fellowships. And what's so important about that is the more people who train here are more likely to stay here and provide care and overcome the physician and healthcare shortage that the entire state experiences.
And I would say that's really important to our vision. The vision at UNR Med is a healthy Nevada, but how do we get there? We rank really poorly in terms of supply of physicians in the state. You can pick a specialty anywhere from 45th in the country to 50th in terms of number of physicians per 100,000 population. We have to fix that. And we've looked at our own data, and most of this comes from the Office of Statewide Initiatives at UNR. 40% of our medical students ultimately practice in the state, 60% of our residents. Those are numbers that might be lower than one would expect. But if you have an individual who was both a student and a resident here, that number gets close to 80%, which actually is one of the top figures in the country. So part of what we're trying to do here is to not only grow the medical school, but most importantly, our opportunities in graduate medical education, because then we can retain those physicians. And we're beginning to see that actually among our current residency programs and fellowships.
Is there something that you do specifically to keep folks coming back to get to that 80%, or is it more a matter of just the experience that they have turns out that way?
Well, I think a lot of it is that, you take a relatively young medical student, may not have roots yet, families, so forth, but by the time they finish their residency and fellowship, because it's a really long course of education, they've put roots down, and then they want to stay. We also believe that we can attract students and residents from outside Nevada, and once they come here and see how incredible Northern Nevada is, they'll want to stay. But it's not just Northern Nevada. We really believe this is relevant to the whole state. The shortage is throughout the state. And we have a lot of rural communities who need primary care physicians. They need better access to specialists, and that's really one of our obligations.
Gotcha. Did you have something you wanted to add?
The only thing that I would add to the conversation is certainly the fellowships and residencies are a priority and are significant, but I've been amazed to also see our relationship, the affiliation relationship, has also poured over into many other specialties like RNs and APRNs and PA program and tech positions. We've been able to grow a number of our shortage areas, and so that's been super beneficial.
Why do you think that is? Like, what is it that's helping kind of get that extra push for those other folks?
I think it's our combined attention to education.
It truly is, and just the willpower and just recognizing the need, and because we have the relationship and with the university and the excellent tradition of education, help us design programs and do so very successfully.
And there's a dynamic leader at the Orvis School of Nursing, Charlie Yingling, who's been working closely with Renown to expand opportunities for nursing students. And we're about to launch within the next year a new certificate program in medical lab science. We can't underestimate how important the non-physician is to the running of an academic health system, whether you're helping to run the chemistry lab or the hematology lab, or you're an echo technician or an x-ray technician and so forth. These jobs are absolutely crucial, and we have to do a better job of training them. And so that's part of our mission as well.
Gotcha. So it sounds like these are kind of focusing on areas of the hospital that normally when I think of a person thinks of a hospital, they think of like the doctor and the nurse and maybe like a charge nurse. But there's so many other people throughout the hospital doing all that support and work. And I actually was in the lab area. It truly is kind of in a hidden hallway. So you guys are thinking about all those folks too, it sounds like, and as you're doing this.
Yeah, we're 100% reliant on the others. It's definitely a team sport, providing great care. And you can be the best doctor in the world, but work with the best nurse. But if you don't have a pharmacist, you don't have a lab, a radiology tech, and support structure, you can't provide the care.
And earlier you mentioned, Chris, dealing with kind of state legislators. Is there an element of the government that is required to make this partnership work at all?
Well, interesting that you would raise that. Certainly, much of the sustainability of our ability to maintain the programs we have, but even more importantly, grow programs, we need funding. And the federal government has long since capped existing programs like the one at Renown. Our original relationship with the School of Medicine started in the 70s, and so we've been long time small program, and through this affiliation, we really have focused on and have built readiness to grow programs in OB and surgery and fellowships like cardiology and oncology and neurology, and I'm sorry if I missed anology, but there's some key programs. Pulmonology is the other one pulmonology critical care was the other one I was thinking of. But these programs are critical to us moving forward and having a great educational opportunity at Renown, and we do need additional, we're always seeking additional funding. Medicaid has opened up some opportunities, and we're excited about that, and our state has also opened up some grant funds, and Dr. Hopman and I both serve on a committee that's going to help allocate funds statewide, and we'll be working to try to get grant funds, but it's the sustainable funding going forward that keeps me up at night. I don't know about you, Dr. Hopman.
Is the funding essentially set up to create the programs you're talking about? Is that what creates the research opportunities or like the physical labs, or is it kind of a combination of things that is needed for?
So the funding that exists is generally focused on hospital operations and the costs of the actual resident and fellowship programs along with the faculty. So that's where the funding goes. I would argue the other elements that you just raised are also significant needs relative to building our research capabilities at the school. And those are going to be tough dollars to find, but they're on our short list to try to work either through philanthropy, through national grants, through local grants, because research is very expensive. But at the end of the day, that investment is critical to our success and our ability to deliver the best care and provide the best learning environment, and also has significant downstream economic impact.
Oh,
So.
do you guys want to talk about the downstream economic impact? That's really interesting.
Yeah, the only piece I would add, I'm not a big economic expert, but what you hear is that when you've got a highly functioning research arm, what happens is large companies want to locate near you. So pharma, other types of for-profit labs, et cetera, want to be near that activity.
Oh, interesting. Are they able to make use of that research by integrating with the school or like paying for time or anything like that? Or is it just that they want the people who come out of that work?
Probably all of it.
Yeah, I would say, both. We do have industry partnerships. Those are often contractual, but they can be through grants as well. I do think that there's the environment right now is really exciting. It's exciting to be part of this. This affiliation is transformative. I think if it were a 10-year affiliation, we wouldn't be this far along, because it wouldn't suggest a true commitment. But at 50 years, the affiliation will outlive all of us, and we know that this is the future. It's the future for UNR Med. It's the future for Renown. It's an important model for the rest of the country. There are other affiliations around the U.S. We like to believe that this is one of the most creative ones, and I think it's been incredibly productive. So it takes a lot of commitment, a lot of time. We have regular meetings, UNR Med with Renown, to ensure that we make progress and satisfy our vision and fulfill the promise of this pillar that we call Build an Integrated Academic Health System.
I was wondering if you can give maybe more nitty-gritty context on what makes it a creative model different from other places in the country, or like what does it kind of look like day to day that makes it unique or different?
Well, I think if you combine, let's say, the history of our relationship and then where we want to be, and moving along that path is pretty unusual. While we're steeped in history, UNR Med is the first medical school in the state, and Renown is the first hospital in the state. We understand what our obligation is to the community, and I think just my experience here, this is not my first position and it's not my first academic health system. It's just my sense here is that there's a genuine and real commitment to the state and to the people of the state, and that makes coming to work all the more exciting.
Oh, awesome. Maybe Dr. Plow, do you have similar, being in a different position, like what does the day-to-day feel like working together with the school?
It's been a wonderful journey. As I shared, I'd been out of academics for quite some time. So when came to Renown, really Dr. Hauptman took me under his wing and helped mentor me, which has been terrific. And it's been a wonderful experience getting to work with my colleagues at UNR and with the different leaders that Dr. Hauptman has brought into the organization. Just thinking of Dr. Alicia Diaz-Thomas and Dr. Lauren Schwartz and some of the other leaders of the School of Medicine that are helping build out the faculty and helping develop these programs. When I go between the different hospitals or have our different meetings, I know I'm just working with friends, and it's just very collegial. We all know why we're here. We have a lot of flexibility and control because we're all locally owned, not-for-profit, aligned missions. We're not answering to Pennsylvania or some other place. And every dollar we make gets reinvested back into the community to help our neighbors and friends. And so it's a job we love, and we recognize the difference, but we're also just so appreciative of the community when we talk of the philanthropy and all the support that the community has given in supporting both institutions. They've really made both institutions what they are today. So in my experience, it's just been a lot of fun.
Cool.
Actually.
Do you have anything that you wanted to add, Chris?
No, actually, I think both of you said it perfectly.
On the bottom of the pillar, it talks about broadening the branding opportunities between the school and Renown. And I'm curious your thoughts on what does that mean for, I guess, each other, and then also like a community member who might see that. Why is that important to them, or like what does that look like? What does that mean?
Well, I think that of all the parts in this pillar, that's the one that is probably least developed right now. I mean, the university is considering a branding reset, and so is Renown. So I think that's a little bit more of a 2027 goal, perhaps. But there's no question, and I think Bill highlighted it, that we have a very strong standing in the community, both UNR and Renown. And you could argue we don't really have to brand that much. I mean, because people recognize the medical school, they recognize UNR, they recognize Renown. I do think maybe there's a bit of a misunderstanding. What does the affiliation actually really mean? And that's why we're thankful to have this opportunity. It's important to note that Renown is the only academic not-for-profit health system in the region, and that really is key because, as he mentioned, there's constant reinvestment in the community for the benefit of the community.
Yeah, that makes sense. I'm thinking about, like, you mentioned rurals before, and that comes up a lot when we've talked to the school, but I don't remember if we've talked about it a lot on the show yet, and how what you guys are doing here helps rural communities throughout Nevada. I was wondering who would like to talk about how that helps kind of like the areas that aren't just like down the street from where we're located right now.
Well, at UNR Med, I'll begin, but I think Chris can also fill in the blanks here. I mean, at UNR Med, we have in the Office of Statewide Initiatives multiple programs in our rural communities. Everything from a loan repayment program to educational programs. We have Project Echo, for example, where providers in rural communities can call in, they get advice, there are often lectures and the ability to learn some recent developments, whether it's in hypertension or management of depression or some real core issues. We have an assistant dean who is assigned to the rural affairs portfolio, and he resides in Elko. So it's not just Reno telling the rurals, but he's actually in Elko, Nevada. And each year, the team makes its rounds to the hospitals. We have a very strong relationship with Nevada Rural Health, Hospital Partners as well. And with the upcoming Rural Health Transformation Program, we really think that we have an opportunity to expand these relationships to a historic level.
Renown Health for decades has worked very closely with our rural hospital partners. We see ourselves as the region safety net, and we partner very closely, probably differently than maybe some, in that our goal has always been to try to support our rural partners and support the care that's given locally. So we're not just interested in taking the patient, although that's certainly our commitment, but at the same time, we want to make sure that the best care and the most care that can be delivered locally gets delivered. We've implemented telehealth kinds of resources. We've got federal grants historically so that folks could have tools so that they could see so that we could support care given locally in rural communities, and then created agreements so that those patients got back to their own facilities after the care that only we could provide got provided, and then they get repatriated home. Many of those communities have skilled nursing facilities or other lower levels of care, and it's important for those patients and their families to know and feel like they're going to be able to go back home to get as much of the care as they can. And so that's kind of always been our strategy, however we do it. I agree with Dr. Hotman that this Rural Health Transformation Program has lots of opportunity, given resources will be available to rural communities to expand their ability to provide care locally. So it aligns very much with our strategy, what our strategy has always been. I think maybe some of the new pieces that we might get to see going forward will be in some of the innovation areas, maybe with technology, because there'll be funds to maybe be on similar EHR platforms, electronic health record platforms, maybe implement other systems so that we can support each other and care for patients more seamlessly into the future.
And from an educational standpoint, I'll just mention that we have a rural outreach clinic that's run by our medical students, as well as student outreach clinic, which is more focused in the Reno area. We have a street medicine program for the students and a mandatory rural rotation for our fourth-year medical students. So we really are invested in this concept, and the students know when they matriculate that this is part of our identity and this is part of our mission.
That's good. Is there anything that you run into in terms of managing folks who are interested in going out into the rurals or moving, anything like that that comes up?
Well, certainly in our employed practice, we provide support down to the Critical Access Hospital, Carson Valley, and then also, support of physicians doing clinical outreach to some more of the rural cities and areas, particularly cardiology and others. And Chris alluded to some of the technology. We're also expanding the use of artificial intelligence and evaluating patients for stroke, just, so that they can get timely care in the small window of time that you have to treat someone with a stroke that otherwise might not be available in the rural areas. But the secret with working with the rural areas, it's all about collaboration because we all have the common goal of making a healthier Nevada.
Awesome. Well, is there anything else that any of you want to add that I haven't gotten a chance to ask about or that I've totally missed that you guys need to bring up?
I think you've got us there.
Yeah. I'm so appreciative of the opportunity to talk about this. Like the others, I feel like we're in such a special spot with the partnership that we have, and we have this great opportunity to better serve our community while growing the workforce for the region, et cetera. I just think we're in a great spot. We just need to keep it rolling.
Yeah, and I agree with that. And with the collaboration, I think it's also important for everyone to know that when we're talking about teaching and preparing the future healthcare leaders for Nevada, we are fully committed to an OBGYN residency, an addiction medicine fellowship, general surgery residency, and also pulmonary critical care fellowship and other fellowships that make it far more attractive for people to come to the university as medical students and internal medicine residents, because they will have other opportunities to stay in the area. And all of those folks we're training to be exceptional physicians, to be the future leaders here locally and in our rural communities.
Anything else from you, Doctor?
No, that was very well said. And we're nearing the 5-year mark when this agreement was signed, and we often think that there's so much work ahead for us to do, and there is, but we've also come a very long way in 5 years. And Chris can attest to that. But I know in just a little bit more than 3 years, where we were then and where we are now really brings great hope for the next 5 years of the next 45 years, doing the math. And we have some recognition now in an upcoming meeting at the Association of American Medical Colleges. Dr. Erling, the CEO of Renown Health, and I will be presenting what we've accomplished and how we've gotten to this point. So we take that as a really positive sign.
Well, that'll be really nice for other folks to be able to see that then.
Absolutely.
Awesome. Well, thank you all for joining, and thanks to our listeners again for tuning in to our Renown Rounds episode 6.